everyone. I'm Dr. Ekta Bhushan, teaching anatomy and physiology of exercise, sports medicine, and exercise prescription at Indira Gandhi Institute of Physical Education and Sports Sciences, University of Delhi. I welcome you all to online lectures of CEC-UGC. In this series, we will discuss different topics associated with sports medicine, but today in particular, we will discuss the topic first aid. So, we all observe that when individuals fall ill or are injured, they are taken to hospitals or doctors for treatment. But it takes time to reach them, during which, if someone initial care is taken, it helps treatment for such lives. We also observe that some of the minor illnesses or injuries are cured by taking such initial care. However, take care cannot taken unless we are aware and trained in first aid. In the present lesson, we will discuss various aspects of first aid and safety. So, at any moment, you or someone around you could experience an injury or illness. Using basic first aid, you may be able to stop a minor mishap from getting worse. In the case of a serious medical emergency, you may even save a life. That's why it's so important to learn basic first aid skills. To build on the information you learn here, considering taking a first aid course. So, let's have a definition of first aid. When you provide basic medical care to someone experiencing a sudden injury or illness, it's known as first aid. In some cases, first aid consists of the initial support provided to someone in the middle of a medical emergency. This support might help them survive until professional help arrives. In other cases, first aid consists of the care provided to someone with a minor injury. For example, first aid is often all that's needed to treat minor burns, cuts, and insect stings. First aid is the provision of initial care for an illness or injury. It is usually performed by a non-expert person to a sick or injured person until appropriate medical treatment can be accessed in a hospital or by going to a doctor. Certain self-limiting illness or minor injuries may not require further medical care after the first aid intervention. It generally consists of a series simple and in some cases potentially life-saving techniques that an individual can be trained to perform with minimal equipment. The first aid training, therefore, is of value in both preventing and treating sudden illnesses or accidental injuries and in caring for large number of persons caught in a natural disaster. It is a measure both for self-help as well as for the help of others. So, let's look at the self-help. If you as a first aider are prepared to help others, you are better able to take care of yourself in case of injuries or sudden illnesses. Even if your own condition keeps you from caring for yourself, you can direct others in carrying out correct procedures to follow on your behalf. Help for others. Having studied first aid, you are prepared to give others some instructions in first aid to promote among them a reasonable safety attitude and to assess them wisely if they are stricken. There is always an obligation on a humanitarian basis to assist the sick and the helpless. There is no greater satisfaction than that resulting from relieving suffering or saving a life. So, here are the basic objectives of first aid. To give immediate care is the firstmost care. Then to protect the casualty from further harm. Then to relieve pain and to promote recovery. The recovery is prompted as the heart rate goes down, which in turn prevents blood loss from the victim's body. So the main objective of first aid is not to cure but to ensure safety until the patient or affected person access specialized treatment. It is the initial assistance or care of a suddenly sick or injured person. It is the care administered by a person as soon as possible after an illness or accident. It is this prompt care and attention prior to the arrival of the ambulance that sometimes creates the difference between life and death, or between a full or partial recovery. So, as I have mentioned earlier, the major objectives of the first aid is to ensure that the victim reaches the place of specialized treatment safely and life is not lost in between. Then, to prevent further harm, for example, the injury that has taken place does not deteriorate further. Then, to prevent the danger of further injury and to promote recovery. For example, necessary intervening care is taken in a way that promotes recovery and relieves the victim of pain and uneasiness. Now, we'll look into the principles of first aid. So, first principle is to preserve life. The first aim of the first aid is to preserve life, which involves the key emergency practices to ensure that the casualty is not in any mortal danger. Remember, though, this includes preserving your own life, as you should not put yourself in danger in order to apply first aid. It is at this point where you should do a quick risk assessment to check for dangers to the injured person, yourself, or bystanders, which could cause the situation to escalate. If in doubt, do not attempt to apply first aid and immediately call for a medical professional. The next one is prevent deterioration. Once you have followed all the steps associated with the first principle, your next priority is to prevent deterioration of the injured person's condition, keeping a casualty still to avoid aggravating their injury or from complicating any unseen issues is crucial. This helps prevent to further injuries, and clearing the area of any immediate dangers will help you to do so. The next principle is promote recovery. So finally, there are steps you should follow which will help lessen the amount of time taken for a casualty to recover from an accident and aid in minimizing lasting damage and scarring. The prime example of this is applying cold water to a burn as soon as possible to lower the chance of long-term scarring and help speed up the healing process. Now, good first aid practices. Taking Immediate action is the first good practice. So this is the key to the preserving life principle. A quick response to an accident can save lives and minimize the risk that things get worse. If someone needs help, either from an injury or sickness, you shouldn't hesitate to help it if possible. The next one is calming down the situation. First aider should be able to remain calm under pressure and help reduce the overall stress level of the injured person as well as other people who may be concerned. Reassurance can provide more support that you might expect in an emergency situation and help people make the right decisions. The next one is calling for medical assistance. Make sure to get a hold of the emergency services by calling 100 or 112 as soon as possible, either by calling directly yourself or asking a bystander to do so if you are preoccupied handling the injury. This will ensure that a medical professional arrives quickly to handle the situation in a more comprehensive manner and provide more specialized treatment. The next one is apply the relevant treatment. Before a medical professional does arrive, you will need to apply first aid treatment in order to stabilize the condition of the injured person. This comes under the preserve life banner and follow this flow of procedures. That is, check for consciousness, open the airway, check for breathing, follow airway breathing of respiration, administer CPR if needed, check for circulation, check for bleeding, controlling any major bleeding. Then, if you encounter an emergency situation, follow these basic steps. First one is check the scene for danger. Look for anything that might be dangerous like sign of fire, falling debris or violent people. If your safety is at risk, remove yourself from the area and call for help. If the scene is safe, assess the condition of the sick or injured person. Don't move them unless you must do so to protect them from danger. Second one is call for medical help if needed. If you suspect the sick or injured person needs emergency medical care, tell a nearby person to call 100 or the local number for emergency medical services. If you are alone, make the call yourself. Then provide care. If you can do so safely, remain with the sick or injured person until professional help arrives. Cover them with a warm blanket, comfort them and try to keep them calm. If you have basic first aid skills, try to treat any potential life-threatening injuries they have. Remove yourself from danger if at any point in the situation you think your safety might be at risk. Now, we'll learn something about CPR, that is cardiopulmonary resuscitation. So, remember to spell CAB, C-A-B, that is chest compression, opening the airway, rescue breathing. The American Heart Association uses the letters CAB to help people remember the order, perform the steps of CPR, that is comprehension, airway and breathing. Let's start with the first one, chest compression. To perform chest compressions, Kneel next to the person's neck and shoulders. Place the heel of one hand over the center of the person's chest and your other hand on the top of the first hand. Keep your elbows straight and position your shoulders directly above the hands. Using your upper body weight, push straight down on the chest about 2 inches, but not more than 2.4 inches. Push hard at the rate of 100 to 120 compressions a minute. If you haven't been trained in CPR, continue chest compressions until there are signs of movement or until emergency medical personnel take care. If you have been trained in CPR, go on to the opening the airway and rescue breathing. You can see in the picture also how chest compression we can do. See the hand movement and the pace also. Now the next one is open the airway. So if you are trained in CPR and you have performed 30 chest compressions, open the person's airway using the head tilt, chin lift manual. Put your palm on the person's forehead and gently tilt the head back. Then with the other hand, gently lift the chin forward to open the airway. Like this, you can see in the picture. Like this, you have to lift the chin. Now, the third one is rescue breathing. Open the airway using the head tilt, chin lift maneuver. Pinch the nostrils shut for mouth to mouth breathing and cover the person's mouth with yours, making a seal. Give the first respiration breath lasting 1 second and watch to see if the chest rises. If it rises, give the second breath. If the chest doesn't rise, repeat the head tilt, chin lift and first, and then give the second breath. Be careful not to provide too many breaths or to breathe with too much force. After 2 breaths, immediately restart chest compressions to restore blood flow. You can give the breathing like this. So, cardiopulmonary respiration is a life-saving technique that's useful in many emergencies such as a heart attack or near drowning in which someone's breathing or heartbeat has stopped. The American Heart Association recommends start CPR with hard and fast chest compressions. This hands-on only a CPR recommendation applies to both untrained and bystanders and first responders. If you are afraid to do CPR or unsure how to perform CPR correctly, know that it's always better to try than not to do anything at all. So the difference between doing something and doing nothing could be someone's life. Now, here's some advice from the American Heart Association. For untrained people, if you are not trained in CPR or worried about giving rescue breaths, then provide hands-only CPR. That means uninterrupted chest compressions of 100 to 120 a minute until paramedics arrives. You don't need to try rescue breathing. For trained and ready to go, if you are well trained and confident in your ability, check to see if there is a pulse or breathing. If there is no pulse or breathing within 10 seconds, begin chest compressions, start CPR with 30 chest compressions before giving 2 respiration breaths. Trained but rusty. If you have previously received CPR training but you are not confident in your abilities, then just do chest compressions at a rate of 100 to 120 a minute. Now let's look at the first aid kit. It's important to have a well-stocked first aid kit in your home so you can deal with minor accidents and injuries. Your first aid kit should be locked and kept in a cool, dry place out of the reach of the children. Many people also keep a small first aid kit in their car for emergencies. Your basic first aid kit includes plasters in a variety of different sizes and shapes, small, medium and large sterile gauze dressings, at least 2 sterile eye dressings, triangle bandage, crepe rolled bandage, safety pins, disposable sterile gloves, then tweezers, scissors, alcohol-free cleansing wipes, sticky tapes, thermometer, skin rash cream such as hydrocortisone or calendula, then cream or spray to relieve insect bites and stings, antiseptic cream, painkillers such as paracetamol or infant paracetamol for children, aspirin not to given to children under 16 or brufen, then antihistamine cream or tablets, then distilled water for cleansing wounds, eye wash and eye bath. Medicines should be checked regularly to make sure they are within their use by dates. Then outlook. It's important to protect yourself from a contagious illness and other hazards when providing first aid. To help protect yourself, always check for hazards that could put your safety at risk before approaching a sick or injured person. Avoid direct contact with blood, vomit and other body fluids. Wear protective equipment such as nitrile or vinyl gloves. Then when treating someone with an open wound or a breathing barrier when performing rescue breathing. Wash your hands with soaps and water immediately after providing first aid care. Now we have come to the conclusion. In many cases, basic first aid can help stop a minor situation from getting worse. In the case of a medical emergency, first aid might even save a life. If someone has a serious injury or illness, they should receive follow-up care from a medical professional. I hope you understood first aid, its importance and its principles, CPR and what to have in first aid kit. That's all for today. See you next time. Thank you.